Well, a few weeks ago, Dr. Craig Schwimmer from the Snoring Center brought us up to date on sleep apnea. Now, did you know that it's associated with an increased risk of high blood pressure, stroke, and even heart attacks? Today, he's back to tell us the type of treatment options that are available. Good morning, Dr. Schwimmer. It's so nice to have you here.
Good morning, Paige. Good to be here.
This is a big problem. So many people suffer
Yes,
from this, and the consequences of not receiving treatment can be pretty severe.
Absolutely. Sleep apnea is a very significant health issue. As you said, it's associated with a whole host of cardiovascular diseases as well as diabetes, obesity, automobile accidents, because people with sleep apnea are tired. So sleep apnea is not something to ignore. It's something that really does need to be treated.
Well, let's talk a little bit about the causes of sleep apnea. And I know that we've got some images here that can help kind of reflect that. But what is happening internally that's causing this condition?
So sleep apnea is a condition that's characterized by loud snoring. And basically, people with sleep apnea go through cycles during the night where the tissue in the throat relaxes, and as they're breathing, the tissue is not only vibrating, which makes the sound of snoring, but it's actually vibrating to the point where it's blocking the airway. So people with sleep apnea go through cycles where they stop breathing. And when you stop breathing, the oxygen level in your blood decreases. Your brain senses this, and in order to protect you, it wakes you up very briefly. And so during the course of the night, people with sleep apnea will go sometimes hundreds of times through cycles where they snore, stop breathing, suffer a decrease in oxygen, wake up to reestablish the airway, and then fall back asleep. And these events are very stressful on the heart, and because you have these repeated awakenings, it also interrupts sleep architecture, so they don't get normal, healthy, restorative sleep.
Also, another question I wanted to ask you, those that may be on a sleep aid, could that even be more dangerous if these circumstances happen?
Absolutely. Any sort of sedating medication can make snoring and sleep apnea worse, particularly alcohol. That's really the biggest player.
Okay. All right. So what can be done?
So there are a variety of treatment options. The standard therapy for a long time has been something called CPAP, C-P-A-P, which stands for Continuous Positive Airway Pressure. And this is a mask that people wear, and it's worn over the face.
I've seen those before.
Yes, and there's a little hose, and it goes to an air compressor on the side of the bed. And what it does is it blows air under pressure into the nose to keep the airway open.
It sounds a little uncomfortable and awkward.
Well, it is. And CPAP is a mixed blessing. It's non-invasive, and it can be remarkably effective. On the other hand, it's very cumbersome, and most studies show that most people don't wear it regularly.
So even though they know the risks of not wearing it, then they still, because it's uncomfortable, because it looks awkward, they're not going to wear it.
They're human beings.
Right.
And so, to me, people with sleep apnea really come in two categories. There are those that do well with CPAP and those that don't.
All right. And then you also write this. I want to make sure we have time to talk about this. This is another option that's available for people with sleep apnea.
Yes, so this is another alternative, and this is something, a dental device called a mandibular advancement device. And this is something that's worn to bed, and it works by pulling the lower jaw forward like this. And like
so do you look kind of like Jay Leno after it's done?
Well, that's the issue, is that these things can be effective, but they can also be quite problematic in that they require the patient to wear it, and it's unpleasant, and so not everybody will. And if you do, because it works by pulling the jaw forward, disruption of the jaw joint, shifting of the teeth are not uncommon complications. And so these things are also a set of compromises.
All right, so it does sound like there are treatment options available, but there are consequences or challenges associated. Is there another option that's out there for us?
Sure. So there's traditional surgical therapy, but what I find most exciting are these newer, minimally invasive office-based treatments, and that's what we specialize in at the Snoring Center, because they're a very attractive set of compromises, a very rational starting point for a lot of people, because there's no compliance issue. There's nothing to do, nothing to wear. You don't have the pain and morbidity of surgery, and yet they're quite effective. And so we'll talk about some of those next time, I know, but to me, really the most exciting avenue has been the development of these minimally invasive treatment options.
That's really good information. I can't wait for you to come back on and tell us about these different choices. It looks like a possibly a better alternative for sure. Thank you so much. And for more details on sleep apnea and Dr. Schwimmer, you can log on to snoringcenter.com. Todd?